All right, team. The patient presents with symptoms of pneumonitis, dermatopulmonosities, and encephalitis.
What are your thoughts on the diagnosis?
Based on the symptoms, I think it could be a rare autoimmune disease like dermatomyositis.
I agree with Gary. The combination of skin rash, muscle weakness, and lung inflammation points towards dermatomyositis.
But what about the encephalitis symptom? Could it be related to a central nervous system disorder instead?
No, it's not any of those. The correct diagnosis is lethal congenital contracture syndrome. We need to perform a synovectomy immediately.
But sir, that procedure is extremely risky. Are you sure it's the right treatment?
Damn it, I know it's risky, but it's our only chance to save the patient. We have to move quickly. Get ready for the surgery team.
Let's do this. We have to trust in Dr. Hawk's expertise.
I'll prepare the operating room. We're in this together.
Good. Time is of the essence. Let's save this patient's life. Tracy, I need to talk to you about a patient of mine. I believe performing a synovectomy is the best course of action for them.
Are you sure about this? Have you considered all the risks involved, especially with a patient who might have lethal congenital contracture syndrome?
I've been practicing medicine for over a decade, Tracy. I know what I'm doing. My experience should speak for itself.
I understand your expertise, Hawks, but I have to ensure we're making the right decision for the patient's well-being. Let's discuss this further before moving forward with the procedure.
I can't believe you're questioning me on this. I know what's best for my patient, and I won't let anyone stand in the way of providing them with the care they need.
Hawks, I'm not trying to undermine you. I just want to make sure we're considering all our options before proceeding. Let's work together to come up with the best plan for the patient.
Fine, let's discuss it further. But remember, I have the patient's best interest at heart, and I will do everything in my power to help them.
God damn it.
It seems the patient is in critical condition. This is not good.
I have to tell Hawks that the synovectomy was not the right treatment for lethal congenital contracture syndrome. How am I going to break this news to him? He trusted me with the treatment plan. Dear Lord, I know you don't hear from me a lot, but my patient is dying. How can I show Hawks that we simply cannot play you and risk our patient's life? Time is of the essence here.
What in the world were you thinking? You nearly killed that patient with your incompetence.
We followed the protocol, Hawks. We made the best decision with the information we had.
I still think it was the right call based on the symptoms presented.
Maybe we missed something, but we did what we thought was right in the moment.
You all are a bunch of imbeciles. You can't even tell your left from your right when it comes to a simple diagnosis. I can't believe I have to work with such incompetence.
We did our best, Hawks. We can't catch everything.
Maybe we should reconsider the treatment plan next time.
I agree. Maybe we need to be more thorough in our evaluations.
Thorough. You call what you did thorough. It was a disaster waiting to happen. I can't rely on any of you to make the right call. I'm done with this nonsense. Figure it out yourselves. I can't believe I haven't figured it out yet. This case is driving me crazy.
Maybe you need to take a step back and look at it from a different angle. Have you considered checking for a rare condition?
I've checked for that already. What about a genetic mutation? Maybe we missed something in the genome sequencing.
That could be it. Or perhaps it's a combination of factors we haven't considered.
Wait a minute. I think I know what it is. Johnson, thanks for the suggestions. I need to go check something out. I'll catch you later.
Wait, what? You're leaving just like that. What did you figure out?
I've got the new diagnosis, guys. Lethal congenital contracture syndrome was a misdiagnosis.
Hawks, you can't just storm into the operating room without proper medical equipment. It's reckless.
Yeah, this is serious. We need to follow protocol.
What makes you so sure about this new diagnosis, Hawks? We can't just switch things up like that.
Trust me, this is it. Metachromatic leukodystrophy. We need to act fast. Tracy, I finally found the right diagnosis for the patient. It was a tough case, but we got there in the end.
Congratulations, Hawks. That's great news.
You know, Tracy, if you had just listened to me from the beginning, we could have avoided all the confusion with the wrong diagnosis.
I'm not sure I understand, Hawks. What do you mean?
I mean, If you trusted my expertise earlier on, we wouldn't have wasted all this time on the wrong track.
I see. Well, I'm glad we finally got to the correct diagnosis. Thank you, Hawks.